So guys, let's talk about panic disorder and panic attack again. So what is a panic disorder and what is a panic attack? So panic attack is a constellation of symptoms. These are basically the symptoms of panic disorder. Panic disorder is a disease. So when I say disease and symptoms, what do I mean by that? For example, we were in COVID few years back, right? So COVID is a disease. COVID is not a symptom. Cough, fever, insomnia, weakness, loss of taste, loss of smell, all these are symptoms. So there is a difference between the symptoms and the disease. So panic disorder is a disease, and the symptom that occurs due to panic disorder is panic attacks. So panic attack is a group of symptoms. What are these symptoms? A person can have lot of physical symptoms in panic attack. So what are these symptoms? Person can feel sweating, trembling, unsteadiness, then depersonalization and derealization. A person can feel that he or she is detached from his or her body. World is not real anymore. So depersonalization. Excessive heart rate. Okay. Then nausea. Then dizziness. All these symptoms basically. Then there will be shortness of breath. Then there can be fear of dying. We will talk about that. Then there can be choking sensation. There can be chills. All these symptoms will be there. You can remember these symptoms with the help of a mnemonic. Students, fear, 3 C's. So I have said that in the order. Go back in the video and you will hear students, fear, 3 C's. Or you can search on the Google. So basically these symptoms are there. So if you find 4 out of these symptoms, 4 symptoms out of all these symptoms, that means it is a panic attack. Now, the main thing to remember here is that panic attack is a physiological symptoms, bodily symptoms. It does not mainly have psychological symptoms. So that is the difference between anxiety and panic attack. In anxiety, person will feel anxious. He will worry a lot, but that is mainly mental. He will not have any sweating. He will not have excessive heart rating. He will not have nausea or anything. So the main thing to remember is that in panic attack, the person will mainly have physical symptoms. In anxiety, it is anxiety. You know what is anxiety. We will discuss about that. So the problem is not panic attack itself. A person can have lot of these symptoms for the period of 10 minutes to 1 hour. But that is not a problem. It will come and it will go. You will still survive. But the problem is what then? The problem is the interpretation of these symptoms. Suppose you are sitting in a room. Right now, if you start sweating, you are listening to this video, you have excessive heart rate, you feel that you are detached from your body, you have shortness of breath. All these things happen all at once in the period of 10 minutes, for the period of 10 minutes, and it can stretch up to 1 hour. Then will you not feel scared? If yes, then that person who is feeling these symptoms and develops a fear of dying, is he wrong or right? He is right in herself or himself. But this fear of dying, this interpretation of these symptoms over a period of time is the problem. That is what cripples a person. That is what makes the life difficult for this person. Now, we talked about panic attacks. We talked about all these symptoms. But the interpretation of these symptoms led to the adaptive behaviors in life. What is adaptive behaviors in life? That means he will not go out alone. She will not go out alone. If she has to go to a restaurant or he has to go to a restaurant, then she will find or he will find a restaurant with 3 bathrooms. Because if panic attack comes, then she wants to go to bathroom to relax so that nobody can see the panic symptoms and she can be on her own, or like these kind of things basically. He or she will not go to swimming. He or she will not go to movies, not go to gym. So he will restrict himself in a room, so that if panic attack comes, he can handle it. So that is basically an adaptive behavior. So he will not go out in any space or anywhere from where he cannot escape. He will always have a contingency plan. Now think about it. How difficult the life will become for this person. Like if he goes in a flight, then he will feel that he is stuck. He will develop a phobia later. He or she cannot go into a tunnel. All these things basically will be there. This is called agoraphobia. So panic attack or panic disorder can lead to agoraphobia. Now coming back to the topic, what is the difference between panic attack and panic disorder? The constellation of symptom is called panic attack. But if a person develop these adaptive behaviors, agoraphobia, not going out, always keeping the medication, or trying to avoid the symptoms altogether. For example, how he or she will avoid the symptoms. We discussed that one of the symptoms is nausea and vomiting. So he will not eat much so that he don't develop a nausea or vomiting. And nausea and vomiting is not a problem because he knows that if nausea or vomiting develop, then panic attack may come. This is his interpretation. It is not that indigestion can lead to panic disorder. But he thinks that if nausea or vomiting develops or dizziness develops, then it is reflective of a oncoming panic attack. So that is how adaptive behaviors develop. So that is a problem. So that is the difference between panic attack and panic disorder. Panic attack plus maladaptive behaviors or adaptive behaviors and persistent worry of having another panic attack for a period of 1 month is called panic disorder. So that is what it is. Now, what you should do if you have a panic attack or panic disorder, then you should you go to the emergency? I said before in this video that panic attack is not going to kill you. Then you should go to the emergency or you should not go to the emergency. By all means, you should go to the emergency. And the reason is that you don't know whether it is a panic attack or not. You have these symptoms, it can be a heart attack. It can be a thyroid problem. It may be that your glucose is low. And it is very much possible that you have a pheochromocytoma. You can have mitral valve prolapse. You can have any heart disease. So how do you know it is only a panic attack? It may be a more sinister problem. So you want to go to the emergency. It is not your duty as a patient to decide whether you have a panic attack, panic disorder, or there is something else. Let the doctor decide. So go to the emergency. Get everything ruled out. Get an ECG done. Get an echo done. Get all thyroid tests done. Get blood glucose done. Get metanephrine done, and all the possible, like all the investigation that doctor suggests, you should get it done so that you know that it is only a panic attack or only a panic disorder. So first thing is go to the emergency. Second thing is, what else can help it? Like the CBT can help it. CBT is cognitive behavioral therapy. So it will not help you with the panic symptoms, panic attack symptoms. Like the physical symptoms that we discussed, the therapy will not help that. The therapy will help in the maladaptive behavior or the interpretation of these symptoms. It will help you with the fear of dying. When you have these symptoms, the panic attack symptoms, and as I said before that you can develop a fear of dying, there can be thoughts of impending doom. So that interpretation can be challenged in cognitive behavioral therapy, and you can have a normal behavior. They will teach you how to deal with the panic attacks. They will tell you that you can see these as symptoms only, along with the medications, of course. So cognitive behavioral therapy can help you challenge your beliefs about the panic attacks, and they can help with the interpretation of these symptoms and can help you reduce the chances of having a full-blown panic disorder. Now coming to breathing techniques and meditation. So this is my favorite topic, like breathing techniques. Think about a person who is having a panic attack, and you tell him that take a polybag and start breathing into it. Can he do that? No. So breathing techniques have an average evidence. Like they are not very good, they are not very bad. Literature says that it has average evidence. So what kind of breathing techniques? So for breathing techniques and meditation, it is very important that you learn them from a trained expert. It is not that you do anything. People do anything in the name of meditation. Like they will just sit with their eyes closed and just do anything. I don't know. But you should get trained in meditation. Like my personal opinion is Vipassana meditation is the best. I have attended 10 days course, but I'm no one to talk about it. Basically, I'm too small to talk about it. But I think it is a very good type of meditation, and it keeps the life chill, and you know how to deal with life, and you remain happy basically. So it is not in the context of panic disorder or panic attack, but I'm just saying that. Now breathing techniques. So I will talk about some breathing techniques that are mentioned in the literature. So one is cardiac coherence. In cardiac coherence, what you do, you match your cardiac cycle with the breathing cycle. You inhale for 5 seconds and you exhale for 5 seconds slowly. So 5 seconds plus 5 seconds, 10 seconds. So one inhalation 5 seconds, one exhalation 5 seconds. And if you repeat it 6 times, it becomes 1 minute. So do it 5 times, it becomes 5 minutes. So each session should last about 5 minutes. So that is cardiac coherence. Another thing you can do is hyperventilate. When you hyperventilate, what happens? Like you wash out CO2 in your system. So we all know that when we breathe, we take in oxygen, we throw out carbon dioxide. So if you hyperventilate consciously, like breathing, very fast breathing basically, what will happen? All the CO2 in your system will wash out. So now your body will send a signal to your breathing system that breathe slow. So your breath will become slow, your respiration rate will become slow, and you will get rid of the anxiety. This helps in lot of problems which has anxiety at its core. So that is one thing. So this is for breath of fire technique basically. So these two techniques can help. Then coming to the medications. What medications can help? So there are two classes of medication that are mentioned for the treatment of this panic attack and panic disorder. One is benzodiazepines, one is antidepressant medication classes. So let's talk about benzodiazepine. So benzodiazepine will not help in treating the panic disorder. They can help relieve the symptoms of panic attack. So if you are having symptoms and you take benzodiazepines like alprazolam or Xanax, clonazepam, all these drugs, then they will help in reducing the symptoms. But do you want to do that? Because benzodiazepines are very addictive. They're really very addictive. You take them for 15 days, you are addicted to them. And it is very difficult to get rid of them. And they have a lot of side effects. So as I said before, panic attack will resolve by itself. So why do you want to get addicted to a class of drug which is very difficult to get rid of? Now you are just switching problems. You are relieving the symptoms of panic attack, which are not going to harm you in any whichever way if you have ruled out everything, but you are getting addicted to a medication. So don't want to do that. So benzodiazepines can relieve the symptoms of panic attack, but avoid that. Do meditation, do breathing techniques, learn meditation. Just don't sit on a rock by the seaside and get yourself flicked and call that meditation. Just don't sit with your eyes closed and let your thoughts come in and say that I'm doing meditation. No, meditation has to be learned. Like, this is my personal opinion. You can thrash me, you can do anything, but I believe that meditation has to be learned. If you want to learn it, go to Vipassana, go to any course of your choice, but don't call everything meditation. Too disrespectful. Now, coming to SSRIs and SNRIs. These are the class of antidepressant medication. So SSRI means selective serotonin reuptake inhibitors. There are certain drugs that I will mention that is approved by FDA. So that is sertraline, fluoxetine, paroxetine. So these are the three drugs that is in SSRI class. In SNRI class, SNRI, serotonin, norepinephrine reuptake inhibitor, venlafaxine. So these are the four drugs that are approved for the treatment of panic attacks and panic disorder. And yeah, so another thing, you don't want to give them on the full dose that you give for depression. You have to give a lower dose, at least half or 2/3 of the dose. So SSRIs and NRIs are not given in the full doses, they are given in the half or 2/3 of the doses. So that's about panic attack and panic disorder. See you in the next video. Thanks for listening. Bye.